let's just talk about this vaccine that is supposedly coming out. This is the fastest anything has ever been developed in the world. And apparently it has no significant side effects, which is a miracle of modern medicine. It is an mRNA vaccine, which is new and somewhat experimental to vaccine development. And it doesn't use the dead or inactive virus particles. That's what you usually get. You get the actual virus put into you, and that, give you the side effects of, headaches and vomiting and fevers and everything else. That's why this one doesn't have those side effects. It's synthetically modified RNA that can't spread the virus because it's not the virus, which makes it completely safe, apparently, to handle and completely safe to manufacture in giant vats or however. I just see some guy with a giant spoon over a boiling pot making this coronavirus stuff. But you don't have to breed bunches of live viruses to create the vaccine. And so that makes this really, really good. Now, I'd like to point out that this is the proof that the public-private partnership that is the hallmark of the American approach to problem solving, from, fighter jets to space vehicles to medicine, they are not produced in government-owned factories by government scientists, but rather are produced by private companies via the free market. Yes, they do have an intention to make profit, and that profit motive is exactly why American companies seem to be the first to bring effective and powerful medical treatments, cars, and engines to the market first. We learned this in the fight against the Soviet Union. We learned that they started to make horrible things because they didn't have any experts and the free market wouldn't correct their mistakes. Now, it's important to point out that Pfizer isn't alone. Stu pointed out a minute ago, Moderna and Johnson & Johnson are expected to deliver COVID-19 vaccines by the end of the year as well. That'll never happen. Yeah, shut up. There is word that the Russians have a vaccine close to distribution, although a couple of countries have said, yeah, we're having some bad side effects, so we're going to stop testing that here. So this is great news, right? This is great news. No, it's not going to happen. Yeah, I know. I've heard from the Biden campaign. They told us this would not happen. No miracle is coming. We're going to have a dark winter. But it should be hailed as good news. Yet, now we're hearing the vaccine is going to take months, if not years, before it can be widely distributed. Everybody from the WHO, which we're getting back into, yay, and the CDC, on the one hand, celebrate the apparent arrival of the vaccine, but on the other hand, they continue to issue warnings that this isn't going to be out until 2022. And one of the guys that Biden just said is going to be ahead of his COVID police in case he, he wins the presidency. He's got a whole force out there for COVID-19. He said that Americans shouldn't get the doses first. That before we give all of America the doses, we should make sure there's equity and give it to the rest of the world first. Oh. And they're saying that there's going to be widespread distribution globally in 2022. But until that time, we need to continue our social distancing and shutdowns and lockdowns just to make sure everybody is safe. Have the goalposts moved again? First, we had to wear the masks to stay at home to flatten the curve. Then we had to shut the economy down until there was a vaccine. Now that there's a vaccine, we need to stay locked down until there's a fair and equitable distribution of the vaccine. But wait, there's more. If you don't act now, the WHO is also recommending a global COVID-19 task force that would set international and travel-related guidelines for UN member nations, designed to be in effect even after COVID-19 has been eradicated. I think globalists, they're furious that a vaccine has been created. A 90% effective vaccine takes the plans of the World Economic Forum and the World Bank and chucks them out the window. Under the creed of never let a crisis go to waste, they have plans to use the emergency of the COVID-19 pandemic, as the reasoning behind the Great Reset. We're going to be talking about this much more in the coming weeks. It's my next book, The Great Reset. It is the installation of a global government with control over the food supply chain, over medicine and healthcare, global energy supply, environmental policy. They will create a global economic system that forgives third world debt and issues digital currency that the governments around the world can track all transactions. Basically, the goal of the Great Reset is to take over and track all commodities and resources via one central database with control at the UN, but administered by an appointed committee. And COVID-19 was the perfect excuse. And a Biden victory 2020, that is guaranteeing U.S. participation, even leadership in it. But a vaccine widely distributed to America in the tens of millions puts a huge dent in that plan. Over the next few weeks, look for the office of the president-elect and their sycophants in the media to start to poo-poo the vaccine and to come up with every reason that businesses need to stay closed, that companies need to continue to be bailed out, that there's still an emergency that can't be solved by Pfizer in partnership with the U.S. military and private healthcare industry working in concert to save American lives. No, no, no. For them to execute the Great Reset, they need the emergency to persist indefinitely, or at least long enough that Americans will be willing to accept a World Bank digital currency instead of U.S. dollars, will be willing to allow the UN control over our food supplies and medical distribution of the vaccine. Never let a good crisis go to waste. What happens when a for-profit company cancels the crisis with a cure? Well, they have to cancel the cure with more crisis.